Pop quiz. Okay. That happens to you. You're picking up a tennis ball or a piece of paper or an air molecule, I don't care. And you feel your back go out. You feel the pop, you feel it slip, you feel it shift, whatever. All you know is you're in pain and you can't move. What do you do? If your answer is, well, doc, I think we should go lay on the couch. The softer, the better. Throw some ice on there, maybe get some ibuprofen. We got some leftover oxys or muscle relaxants from the surgery we had 5 years ago. Let's just do that. We're gonna rest up until our tissues are healed, and then we'll safely return to the world of activity. That's what you said. You're wrong. And shockingly, this is still the advice that is given by a lot of the medical world and even chiropractors and physical therapists that are just outdated. So what is it that you should do? Those that don't follow my channel, my name is Dr. Chris Collier. I am a sports-based chiropractor and a strength conditioning specialist. I like to make videos to help people move their body, explore exercise, as well as how to manage certain injuries and other ailments. If you're interested in that type of thing, go ahead and hit subscribe. So what's my recommendation? Well, first let's lay some groundwork, okay? I always want patients to know that hurt does not equal harm. So you hurt your back, and then when you bend and you move and it gives you that knife stabbing pain in the back, that doesn't mean that we're damaging the tissues on the inside, or we're squeezing more of the jelly out of the donut, whatever analogy you want to use. So it's not what's happening. Think of pain as a signal. Sometimes it does mean, hey, dude, stop, pump your brakes a bit, but it never means stop everything. I look at it as a way, if I bend over and it really hurts, I'm gonna try to bend over differently. Oh, okay, it didn't hurt so much. Or I'm gonna bend over in a way where my core is engaged, or maybe I'm creating a little bit more stiffness or stability in some of the parts of my body. Maybe that makes it feel better, great. Sometimes pain, that signal you feel, is actually a good thing and it means keep going. So it's really hard to figure this stuff out, but you usually can't go wrong pushing into things a little bit more. I know it's counterintuitive, but again, this is our current recommendation. It's not mine, this is most journals, most guidelines for lower back pain. I always try to get people moving as soon as I can. And the more you rest, the worse you'll feel. Okay, and if you're waiting for your pain to go away before you do anything, you might be waiting a long time. So it wouldn't make any sense to me then throughout the day to just lay on the couch or sit all day, because you might not have pain in the moment, but when you get up to move, it's gonna suck even more, okay? So I want a steady stream of activity throughout the day. It doesn't mean, hey buddy, stand all day or walk constantly. I want you to sit for a period of time, then stand up, we're gonna move. I like to give specific exercises to help like grease the wheels a bit. You know, we say motion's the lotion. First thing I might have somebody do, we're just gonna look at range of motion. I'm gonna bend over, I'm gonna get baselines. How far can I go until that pain starts to kick in? I'm gonna lean backwards. I'm gonna go side to side. I'm gonna rotate both ways. I wanna know what's painful, what's not, what's your range of motion, the quality of it, what direction looks good, which one's really limited, which one's really painful. So what's interesting, sometimes like bending forward is the most painful and it's limited, but they can't really go backwards, but it's not painful. This gives me ideas of what I'm gonna try to recommend to people. I'm probably gonna make them go into the most limited, non-painful position first, and then I go and I recheck range of motion. So the couple drills that I like to do to get things back up to speed are very common. We call, press ups and or back extensions. Press up, depending on how sensitive your back is at the moment, just laying on your belly may be all that you can handle. Just that gives you a little bit of extension. I always want to work on good diaphragmatic breathing. So that's going to help you kind of down regulate your nervous system and just calm the F down, if you will. I might just start here, and then can I start to prop up onto my elbows? And then if I can graduate from that, then I'm just going to push up from my elbows. I can prop up a little bit higher here, down, and then up. Trying to keep my hips on the table, down and up. Then we start to push up and down through here. The other alternative to the press up would just be standing. So I might put my hands here and just kind of lean backwards and then back to neutral. Go a little bit further, back to neutral. So maybe the extensions aren't helping as much. So maybe our directional preference is flexion, So I just have people lay on their back, pull their knees up to their chest, and relax. Same thing, work on breathing, make sure you're totally calm, nice and easy, get to that end range, and then relax. Going to go hands and knees. Now, instead of doing the whole spine, which is fine, I'm just gonna focus on my lower back and my pelvis. So I'm gonna work on just trying to extend, trying to go as far as I can, work on breath in that position. I'm totally relaxed. And then I'm gonna really work on tucking and flexing through the lower back and through my pelvis by using my glutes to tilt me under like this, and then back down. Now, if there's no pain with this, great, go to town. Work into as much range as you can. Now, if some of this is painful, you'll find that it's not like painful in the mid-range, but maybe towards the end range, I can kind of feel it. So what you're gonna do is kind of back off. You're gonna really relax, and then you're gonna sink back into it. Just go a little bit further, and then we relax, and we go a little bit further, and just trying to work your way into it. And then I'll work the flexion. Up, 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 and then down. Up, 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 and down. I don't really have a, hey, do 10 reps, 15 reps. I just want you to maybe spend a few minutes working on each exercise, and then you reassess yourself. Take a break, go about your day, work on your computer, do whatever you got to do, and then after an hour or two, then get back and let's do these again. Give you guys a little bit of some quick and easy options like cat camels and press ups, extensions, you name it, to just grease the wheels a bit. Know that hurt doesn't equal harm, and we're just trying to explore our movements. And it's not the only way. There are other exercises that people can do. Obviously in office, I'm trying all sorts of things to get people moving. And then I kind of mentioned a little bit earlier, like you could just skip all the motion exercises and go straight to like core and strength stuff too. Like whatever you can do to, work through things, and it's not too painful, but it's manageable. And it doesn't obviously make you worse after. So there's a lot of coaching and education involved during a session like this. So if you have any questions or comments or personal experiences or things that have worked for you, I'd love to hear it. Show it in the comments. And yeah, I'll see you on the next video.